Dr. Awan, based on what Nick Harper, our reporter, just told us, it looks like the CDC advisory panel is recommending COVID vaccines based on individual preferences. What are you hearing, and what are the risks of that?
Thanks for having me on, Asieh. Well, first of all, I think that this is going to limit and restrict the amount of people that will actually get the COVID vaccine, because remember, you now have to have a risk factor or a high risk factor for severe COVID infection. And there's a lot of confusion about, well, what constitutes a risk per se? And as an example, let's take pregnancy. You know, the CDC has previously said that pregnancy is a risk factor for severe COVID. But remember, Secretary Kennedy later said that pregnant women would not get the vaccine. So this type of confusion is going to sow distrust. It's going to undermine confidence in vaccines. And we don't know what the effect is going to be going forward. And this type of rhetoric is very dangerous when we consider infectious diseases. I mean, if we take a look at what happened just this year in America, I mean, in Texas with measles, it's because of vaccine hesitancy and parents not vaccinating their children that 2 children died, and these deaths could have been entirely preventable with vaccines. So I'm not exactly sure what the message is here, and that's part of the problem because the messaging has been so unclear, Asieh.
Dr. Awan, how do health experts, how do physicians like yourself cut through all the politics and make sure the public hears what's based on the science?
Well, we have to be as transparent as possible, particularly to our patients. So this is actually also a call to physicians to have meaningful conversations with your patients. The federal government is saying one thing, but I urge all physicians to talk with their patients and be transparent about the evidence. Show the evidence, show articles that demonstrate that, yes, getting vaccination with COVID decreases your risk of hospitalization, decreases your risk of death, as opposed to what some senators have said at Senate confirmation meetings. You know, some of the things that we're hearing is pure misinformation, and this is going to cast doubt on vaccines, and understandably so. I mean, if there are parents that don't know much about science, it's natural to question vaccines given all the chaos and the turmoil that we're hearing. So it is exceedingly important for physicians to have conversations with their patients and to be as transparent as possible with the risks and benefits of vaccines going forward.
And Dr. Awan, I can hear it in your voice. I can tell you're very concerned about the future of public health in this country. How vulnerable do you think the United States is in handling new health threats and future pandemics?
Very vulnerable, Asieh. I mean, if you take a look at what's happened in the last 8 months, thousands of CDC employees have been fired. And these aren't just normal individuals. These are expert individuals that fight public health threats. They prepare us for future pandemics. It would be analogous to firing firefighters at a fire department. Who's going to put out fires? I mean, this is literally an example that I want everyone to understand. Who is going to protect us from public health threats? Who is going to prepare us for future pandemics? It's CDC individuals. You cannot train these type of people overnight. So we are very vulnerable. The CDC is the backbone and should be the backbone of public health here in America. So I fear that more harm than good will be done going forward in the future.
All right, an important conversation. Dr. Omer Awan, thank you so much, sir.